Hi, everybody. Just going live for no reason, but thought I'd come on and say hi, so I'll just wait around for anybody to show up. It looks like some people are coming now. I'll wait. So today and this weekend's the EDS conference, and I was watching it like all morning instead of doing homework, and I really have to do homework and studying. Hi, Rebecca. Hi, Ricardo. So I thought I would do like a 30-minute quick live stream just to come on and say hi, and then I'll go do homework. This is can you tell I'm procrastinating? Hi, everybody. Do I know anybody who's done Botox injections for TMJ? I don't, and I really want to hear people's experiences. Hi, everybody. Has anybody had Botox injections in their jaw for TMJ dysfunction? I thought that this would be a good topic because so many of us deal with this, and I've sort of neglected talking about it. And I think part of the reason is because it was so bad back in high school. And it still is pretty bad, but compared to what it was in high school, it's not that bad. And then also it kind of came along with when my muscle tension dysphonia was pretty bad. And I find that a difficult topic to talk about. So I think sometimes I avoid it a bit. But this is a really important thing. I thought maybe I'm going to make a video talking like about all the things I've done for my jaw and what has and hasn't worked. But I thought that I'd open this up to hear your experiences and you guys can hear them and for me to hear them and me to share mine. That's a lot of, okay, whatever. So Kalina says that they got a mouth guard for this and it's still uncomfortable but helpful. Do you grind your teeth, and is that why it's helpful? I don't ever grind my teeth really, except for actually I notice when I do it, which is when I see like a cute cat or a cute dog or an animal, and I'm like, ah, so cute, and I like chat with the animal as if they can understand me, and I clench my jaw the entire time, so that's not good. But other than that, I don't. To the best of like my knowledge and from what my dentist says, I don't grind my teeth. I don't have any like signs of it at night, I'm saying. So I have like, there's been a few times like where I feel like I've woken up and I've been not grinding my teeth, but like, you know, like clenching. But yeah, I'm not like a big grinder. So I feel like getting a mouth guard might not help. You've had arthrocentesis for TMJD. I really should know what that is, but I don't. So I'm actually just going to look it up for TMJ. This is, okay, so it says that it's a clinical procedure of using a syringe to collect synovial fluid from a joint capsule. So they collect it. That's weird. They take it away. They don't put it in. Did you find that it helped you? Some of the things that I mainly do for TMJ dysfunction is like massage. That's the biggest thing that I've done for it and have for a long time. There are specific massages that I do that like hurt so badly. Like sometimes like I'll start like tearing up, and sometimes like I'll like actually tear up, like it'll go down my cheeks because it really hurts that bad and it just like makes your eyes water. But man, is it helpful. It's just super hard. Let's see. You're contemplating doing it because yours is terrible and a pharmacist and pain provider both said it'd be a good idea. I think your name is Maria. Are you talking about the arthrocentesis, or are you talking about the mouth guard? I'm curious. Okay, so Valerie, you said that you had Botox for migraines and scar tissue. Was it helpful? And two, was it for your jaw, or was it for just like, was it in your jaw? I'm curious. If you want to share your experience, feel free to. So Marty, you said your TMJ joints have deteriorated enough that the right side was replaced. Oh my gosh, 3 times. The left will most likely be replaced in a couple of years from now, if not the entire lower jaw. Wow. Oh my goodness. It really sounds like your jaw is not your friend. Oh my God. Hi, Jennifer. Hi, Leslie. Gloria, you had surgery and they flushed your joint. You have pieces. Huh. I wonder what that means. Did you notice that it helped you? Yeah, so I guess I could talk about some of the things I've done. Oh, and also I'm actually going to give you an update really quickly on this torture mat. Hold on. Because also let me know, does this happen to you? Do you guys feel like your EDS, sorry, not your EDS, your neck and jaw pain, if you get both, go together? That happens for me a lot of the times. Like if my jaw is really bad, my neck is 100% going to be really bad. If my neck is really bad, my jaw's not always really bad, but it's like, you know, always if jaw, then neck. And they are bad. Like they're the place in my body where I get the worst pain, as in like the worst level of pain, you know? And it's one of the few places in my body where I could really just like that consistently, where I'll just kind of just be doing nothing and the entire day or hours at a time, the pain is really bad. Anyway, so I tried this out for my neck, and not sponsored or anything. And I made it on my last video or 2 videos ago. So I wanted to update because I said that I would. Okay, I need to do it more, but this is my quick update. In my opinion, it is helping my muscle tension, which is also kind of what made me think about doing this video. And the reason I say that is because, I don't know if you guys know, I have a condition called muscle tension dysphonia that affects my voice, and the muscles in my neck and that coordinate using your voice, and larynx. And it, like, a big problem is my muscle tension. So singing is painful for me, even though I freaking love to sing. I do it anyway, but I have to do certain things before I sing. And also muscle tension plays a big role. So I've noticed I used this for a few days in a row, and I was able to sing with a lot less pain, and it sounded better, which was like shocking to me. I could tell that I was dealing with like a time where there wasn't very much tension. I don't know. I think that this is helping me. So thought I'd give you an update. I have a link to this. If you have no idea what this is, you can check it out. It's just my my last video that I made. I'll just post it here in case you haven't seen it. I really do think it helps, and it was literally like $19 or $20, which I think is amazing. So the other things that I do, I mentioned that I do massage, and I can go more into detail another time. Okay, here's the video. But I thought that I would just kind of show you some of the things that I do. And one thing is, this is a really big one. There's like this space right here, and I just massage like in a circle, and it hurts so badly. So that's kind of like that's like the basic, you know, like if you just need something really basic, if it's not hurting you, maybe it's that you don't have a problem, but I'm pretty sure it hurts people who have problems too, but like we don't have problems with their jaw. But if it's not hurting you, it's either that there's nothing wrong with your jaw, or that maybe you're just not pressing the right place. Like it should be hurting from my experience. And then another thing that I find so helpful is if you have tracking issues with your jaw, which I think a lot of people with TMJ dysfunction have, where it's like it opens and then if you continue, it goes to the side or something. I have that. It's so annoying and it causes me pain. If you stick your fingers in that same spot I was talking about and try to open up your jaw, and like, this is what I'm not telling you to do this. I'm just telling you what I do. Open up your jaw like straight down. So make sure you don't jut your jaw out, but you just kind of open it while sticking your fingers in there. You won't be able to open up very far, but in doing so, it like prevents your jaw from tracking to another side. It's so painful though. Like, that's probably the furthest I can open, whereas I can open way further if my fingers are not there. But anything after that without my fingers, it'll kind of track to the side of it. It hurts, but I'm telling you, it's amazing. Some other things I've done, actually I can tell you what else I've done, but I'll answer some questions because I don't want to get behind like I always do. Okay. So you said that Botox for your TMD was excellent. Sadly, it doesn't last forever and it's a bit painful and you're sensitive in your skin. So lots of redness and puffiness for a few days. Interesting. Okay. I know I've had a few doctors mention Botox, not on my jaw, but in my traps, so that, and like in my neck and traps, and I don't think anybody's ever said jaw. I could be wrong, but I've heard of it for your jaw, not for this. So I'm thinking to myself, like, I wonder, like, you know, who to chat to about that. I haven't seen a jaw specialist. I really should, and I know I should. I've seen an ENT who like deals with the jaw and with the larynx, but I mean that's not their specialty. And I did do PT for my jaw before. Something, I'll tell you what else I did. Okay. Ooh, yeah, you're saying you had a hard time eating foods. So back when my TMD was really, really bad, I would have kind of two main problems, or three problems, I'd say, when it came to chewing. The first is just like my jaw would click like with every bite, and that was annoying, but it wasn't painful. But chewing, oh my God, was so painful in multiple areas of my jaw. I like couldn't eat nuts. I couldn't eat like anything hard. My doctors told me to go on like a really like a short like liquid diet a bunch of different times for like 3 days or something to try to calm my jaw down. I didn't really do anything. Like chewing was so freaking painful. Oh my God. And then also a lot of singers deal with this. And so I definitely have this without singing. Like it's kind of like just singing made it worse. So yeah. So you're saying that arthrocentesis means that they cleaned out the joint and then they injected a steroid in to help with pain. Got you. Okay, cool. So Maria's saying that your chiropractor and your massage therapist work on your TMJ issues. The chiropractor works on the muscles inside of the mouth using a glove. I was going to mention this. So this is also something that I do, wearing a glove. No, I don't wear a glove, but I'm saying like they wear a glove, like if somebody else does it inside your mouth. I'm definitely going to do this in a video. If you like go in, my hands aren't clean enough for me to do this. There's like a muscle kind of on the inside that you can massage like around there, and it really hurts, but it can be helpful. So I've heard that you have to be careful because you can like irritate it. Something else that you might notice is like also one of the reasons I thought about doing this was also just because my jaw was really bothering me. It was like yesterday or 2 days ago, sometime this week. And it just feels very tight, and I need to start doing that more. And what was I saying? Isabelle, what were you saying? I was saying that my jaw really hurts. It's really tight. I literally don't remember what I was saying. I hate this so freaking much. Well, anyway, I'm going to say something else instead. The cold makes it really bad. Oh, I know what I was going to say. The cold, first of all, makes it really bad. Like whenever it's really cold out, sometimes I get horrible. It's so bad pain that it just happens sometimes. I think it must be when my ears get cold, but it radiates into my jaw and neck. So painful. Oh my God. And it can take like 10 minutes to go away, which I know it doesn't sound like a lot, but like it really hurts when my ears get cold. And this is only in the winter time. I don't ever experience this in the summer, but thought I'd mention that. I'm sure a lot of you guys can relate. The other thing I was going to say is that you'll sometimes notice if you actually paid any attention that a lot of the times when my jaw is bothering me, I don't mean to do this at all, but the reason is my jaw's bothering me because it's really tight and painful. I actually talk a little bit differently. Like it's almost like I try to not open up my jaw very much. And I'm even doing it now, like I can tell. And I've noticed that I've done this the past few days. I hate that. I mean, I do it just anyway, but I feel like sometimes it gets a bit worse. So let's see. They pulled out all your teeth and your dentures lined them up better. You don't suggest this though. Oh gosh. Your favorite food is coconut. Never realized it wasn't meant to cause jaw pain. Just thought everyone else had it. Oh no, it really causes me a lot of jaw pain too. I totally feel you. It's a really, if we're talking about the same like type of coconut, I mean, if you get like young coconut and you're eating it, like it really hurts my jaw. I think first of all, like TMJ dysfunction is super common. I don't know how common it is, but I know it's very common. So many singers had it. Like I was a vocal major in high school, so I did know a lot of people with TMJ dysfunction. Many of them, from what I can tell, have never experienced it truthfully to the degree that I have, which then makes me wonder what are their symptoms, because I feel a bit confused when they tell me. Like, I don't know. But yeah, I don't know. But I'm saying it's very common. Anyway, the reason I'm saying that is because I agree coconut is a very painful thing to eat. And I know that you're not alone with that. I was going to say I had a friend who also told me back in high school, who was a singer, who had TMJD. It also hurt her to chew it. Oh, okay, Jennifer, you're saying that after the dentist, they used to do an ultrasound massage to help your TMJ pain. Wow, I've never heard that. That's so cool. I've had ultrasound, therapeutic ultrasound on my IT bands before because after I guess, like, tore my MPFL and, like, refused to see a knee surgeon after freshman year because I didn't think that I did anything that bad. I don't know, whatever. It was like my knee was so freaking bad and they were trying a bunch of different things. And since my T band's tight, like a lot of people's, it definitely played some sort of role in like pulling my kneecap out. So the therapeutic ultrasound would help for like 30 minutes to 60 minutes at a time. And God, that relief was fantastic for however long it lasted. Hi, Ashley. Oh, something else about the dentist is I always let them know I have TMJD. By the way, you can just call it TMJ. Everybody just calls it TMJ. But like technically it's TMJD as in like dysfunction because everybody technically has TMJ because that's just the joint. LOL, I'm so not funny. But so it's dysfunction of it. So I say TMJD just so that's what it's called. And for some reason, like I just refuse to say TMJ, even though that's literally what everybody calls it. But I feel weird by saying TMJD, but then I feel weird calling it TMJ. And I just like, I'm in this headspace where I'm for some reason debating this really stupid thing. I do this a lot. So dumb. So every single time before I say it, I like think about it. Why? I don't know. Just say something, Isabelle. Okay. So at the dentist, I always tell them I have TMJD and that I can't see and that I can't open my jaw very much. They've always been so understanding whenever I still go to a child's dentist though. Whenever they do like the front teeth, I barely have to open my mouth at all. On the back ones, they can actually put something in there to help hold it open, which I've done for me before because holding it open is very painful, but they've also been able to do it without, making me hold it open. Okay, let's get to questions. So Valerie, you said Botox is very painful, but when it helps, it's worth it. But like others said, it's temporary. You have to do it every 3 months. Okay, Sammy, you said that you get migraines when your neck is really bad. Ooh. Oh, that sucks. I get headaches when my neck is really bad, but luckily I've never had a migraine. So for Maria, your neck and jaw also go together. I think, yeah, okay, it sounds like a lot of people are agreeing. And a bad headache. Multiple people are saying this. Oh my God, okay. I'm so glad to hear I'm not alone with this because it's like the jaw, the neck, and it comes with a tension headache. Because again, so much of this is controlled for me, at least by muscle tension. Okay. Oh, lost my spot. Where am I? Okay. Can I remind you of the mat I specifically ordered? I have the link in the video that I posted just below your comment. I think it was like ProSource. It might say it on here. ProSource Fit. And it was $20 off of Amazon. So cheap. Okay. Let's see. So you said that you get 37 injections for migraines every 3 months. Wait, you get 37 injections every 3 months? Oh my God. Geez. I'm so sorry. That sounds like it must take a lot of your time, and that does not sound good. And you're in the hospital right now from after a hip procedure. Okay, here are my thoughts. I'm thinking about you. Shelby, you said that you have some vocal nodules, so I think that's what causes it. Okay, what did you say before? I can't remember. Oh, okay. You also have a prolotherapy. Dang it. I'm really bad. I keep missing comments. I've never done prolotherapy, but I'd love to hear anybody else's experiences. Yeah, luckily I don't have like nodes or anything. And for me, my like pain can sometimes come from like what feels like my vocal cords. Apparently like your vocal folds don't actually have any nerve endings. I don't know if that's true. So they can actually hurt. I don't know. But what hurts me is like my muscles more, but I do get hoarseness. Okay. Ooh, Gloria, you said that your jaw, I guess, pops loudly and people look at you. That's such an EDS problem, or like such a TMJD problem. That's funny. You were told to curl your tongue to the roof of your mouth and open and close the mouth too for physio for your TMJD. Doesn't help a lot, but a little. Interesting. I've never been told that exercise. Trigger point injections can be very helpful along the neck and shoulders. My dad has done that, and it really helped him. And I've thought about doing it before. Wait, why do I feel like I've done something and I can't think about it? I think I've done something and I literally can't think about it, right? I can't think of what it was. Like something injections. I don't know. Once I had this doctor inject my stomach with like something. I don't fucking know what it was. I was not happy. I didn't want to do it, but I was like, whatever, I'll just do it. It was like, he was like a natural doctor, I guess. I'm not the biggest fan of that. I mean, I'm open-minded, but I'm not like you know. I'm happy in the place where I stand between traditional medicine and alternative medicine, but I'm more traditional, and then I'm open-minded to some alternative stuff for sure. But like that one was really weird, and he just literally I think it was like saline or something really stupid. I don't know. I was not happy. It did not feel good. Has anybody's jaw locked shut? Gloria wants to know. I've known actually a bunch of people who's had their jaw, I don't know necessarily locked shut, because I think they could open it a little bit, but like not enough to like, you know, eat or anything like that, and it would last for a few hours. But I don't think I don't know anybody who's had it like shut, but I've known people who've had it like almost shut for like hours at a time. It sounds horrible. That's never happened to me. Yeah, so Valerie, you're saying Slum's physical therapist can massage. Yeah, I've had a physical therapist. I've been to physical therapy for my jaw and neck. And one time, like it was every single day for, 2 times a week. What do I say every day? 2 times a week for like a year, I'd say. And it helped, but I don't know, like not that much. But it was so bad, guys. It was so fucking bad. Just like my neck and jaw, God, I can't even express. It was fucking horrible. Okay. Let's see. So Valerie wants to know if the pain from ears getting cold can compare to the pain from eating or drinking cold. No, it's like, unless you're saying you get like a different type of pain from drinking cold or eating something that's cold. No, it's like, no, oh my God, it's so much worse. It's so fucking bad. I wonder if other people have had that. It's so painful. That was a loud so. I got very excited by that so. Also, okay, it's kind of too late for me to drink a coffee. I literally had 2 sips. Oh my God, I'm freaking pissed. Okay, let me tell you why I'm pissed. Okay, first of all, this is not, okay, whatever. So this is one of my shirts, right, that I have on Teespring. Okay, Teespring's a little bit behind on shipping out shirts, or not they ship it out immediately, but the time it takes to get to you is delayed, so it took a few weeks. Okay, it doesn't look that bad, but you can see it. I make myself a coffee. This was 5 minutes before this started. I put an ice cube in here, and it just like, dang it, you can't even see it. Now I just seem stupid. And it just like exploded. This is my first time wearing this shirt. I got it yesterday, and I put it in the wash last night. Can you see it? It's like, okay, you can't see it in the camera, but whatever. I got coffee all over, not all over it, but like on different spots on it. And I'm pissed. I don't even know if coffee comes out. I'm not a big coffee drinker. I mean, I go through phases, but I'm not addicted. And I am proud. I get proud of things that are just stupid, but hold on. I need to mix this, but whatever. Let me tell you something. So you don't give a shit, but I'm going to tell you anyway. So back when I was abroad in Scotland for 6 months, it was final season, and final seasons in America, or at least at the schools I've attended, you know, you get a week or half a week to study in between when classes end and when finals start, and finals go on for 1 or 2 weeks, and then the semester's over. No, it is not like that at all when I was in Edinburgh, University of Edinburgh. Anybody from Scotland here? If so, I love you. But So, God, I've had 3 sips of coffee, like 2 before this started, and it's already hitting. God, I have to chill out. So, Isabel, what were you saying? I really think that people must think that I'm really weird. I mean, I think I am kind of weird, and I do have a weird personality. But I think about this from from one of your perspectives, and you're sitting there like, what the fuck is she doing? Okay. Get back to the story so I was doing finals, and their final season lasts for like a month. They have like a month when after class ends, and then finals start, and it goes on for like a week or 2. So every single day for a month, I was studying with one of my friends who I miss so much, Jasmine. She went to the actual school, like University of Edinburgh. She wasn't like a transfer student or anything. Miss her. So we went to like a cafe or to the school library, and literally every single day. And she got me into lattes. I'd never had a latte before. And I was like, wait, that's so funny. Like, there's so much milk in it. I've always wanted this much milk, but I'd always just like, if I ever wanted a coffee, which would probably be like once every 2 months or so, I'd be like, can you just add like a lot of milk, please? But then it would sometimes be too watery, and I didn't understand you needed espresso and milk, and that's it. So I was obsessed, and it's okay. I don't know how to say it, but if anybody here is from the UK or even actually Europe, they have it all over. Costa or Costa. Tell me which one it is. Number 1, Costa. Number 2, Costa. Write it down. Tell me. God, I'm acting weird. And this is why people literally ask really weird questions. Okay, I'll tell you later. Okay, whatever. And so I was drinking it literally every single day for a month. And then from then on, I was like, wow, I freaking love this. And I kind of ever since then have been drinking coffee on and off, like for long periods of time. So like it'll be like 3 weeks and I drink it every single day or most days. And so it's kind of been like that. And recently since quarantine, I've had it most days, but I can still go a day without having it and not even realize I didn't have it and not miss it, not want it or anything. So I'm pretty sure I'm not addicted at all because I don't feel anything. There was a few weeks ago, I didn't have it for like 4 days in a row, didn't notice. And I was like, yeah, I haven't had coffee in a while. Weird. I don't know. I don't have an addictive body, which is fantastic. But at the same time, like I don't have an addictive personality. I've never like been addicted to like a celebrity or anything. I hate when people are like obsessed. Like to a unhealthy degree. You know what I mean? Like 5 million posters in your room. Like there's been people like where I'm like, wow, like I freaking love you, but not people that like my life is you, you know? You know what I'm talking about? Okay. I should stop judging people and just like move the fuck on. Ooh, okay. So you had to have all your teeth out and you can't get used to dentures yet. Interesting. I wonder, did you get them out because of TMJ problems? Okay. Okay, Candace, you said it also bothers you when people say TMJ, but it's not even that, like, it's like, I don't know which one to say because nobody knows. If I say TMJD, people are like, isn't it TMJ? Because that's what everybody calls it. And then one time somebody, like one of my doctors informed me it was TMJD. And then I was like, whoa, that makes sense. And ever since then, I just have this weird inner, like, conversation, which, like, I don't know which one to say. And it should not give, I shouldn't give a shit, but I do for some reason. Candace, I've also tried neck massages, specific for TMJ and neck pain. I did it like once a week for also a year, a little over a year, and man, that helped. But it's really expensive, like really expensive. And insurance didn't cover it. I mean, I think it was like $100 an appointment, and I did it once a week for like over a year. That's crazy. God. Like really insane. Like honestly, like that just shows like that I can't even believe I had like the ability to do that, like the privilege to do that. I'm so lucky. It's crazy. Is muscle tension not part of HEDS? No, it totally is. Again, I think something that like confuses some people is that you're like, how can you be like tight at all? You have EDS, you're loosey goosey. And I guess like one good way to explain it is that if you're looking, if like, let's say we have a mutation that affects a collagen protein, dang it, Isabel, I forgot my train of thought. I was saying try to explain, muscles. So collagen is like a large part of ligaments and a bunch of other things too. But ligaments and skin, and vessel walls, those have so much collagen in them. Like weight by mass, or no, that didn't say that right, a percent by mass. And then if you look at muscles, they have a much lower collagen content. So if collagen's the problem, like you can tell that like your ligaments and skin are going to be affected way more than say your muscles. That's like one way to say it. And then when you have that laxity in your ligaments, again, there's so much more collagen concentrated in your ligaments than in like your muscles. So they're really really lax, and then your muscles have to compensate. And one of the reasons that that's possible is because there isn't nearly as much collagen in those muscles. So it's not even like your muscles are very, very loose. You said that your neck always gets kinked and that it really hurts to eat or talk or anything, and you get a headache. Sometimes I get a kink too. Like I'll wake up and it's like bad, and it'll last for like sometimes a few hours, but it's usually at least a day, sometimes a few days, and it's just like so uncomfortable. I hate when that happens. You're always losing your voice. Like same. Like it's such a day. Like I mean, now it's so much better, but it was so bad in high school. Like thinking about it, I'm totally gonna cry. I can't think about it. It was really bad. It was so bad. I had to like bring a board around, at least in the beginning of the day. And like most days, like my friends knew that I wouldn't talk in the mornings all the time. Like all the time I couldn't. Like a voice wouldn't really come out. Like it felt like it was like stuck. Keep in mind, I don't just have TMJ, I have muscle tension dysphonia, if you didn't hear that part, which is the reason for that. And I was a vocal major. It was horrible. I don't want to talk about it. It was really bad. Okay. Yeah, you lose your voice for talking more than 20 minutes straight. I feel you. It's so painful, and it's really, really uncomfortable. Oops. Okay, I just lost my spot. Okay, wait, hold on. I'm scrolling back up to my spot, but I see number 1. I said Costa at first, I think. Dang it, I can't remember which one I said first. I said Costa. It's Costa. So what I was saying is I fucking love Costa. I should stop cursing because I'm going to leave this up for like a week and then I'll take it down. Okay, where are we at? So you said that they're saying nerves in your neck might be causes of your pain, like neuropathies? Maybe? I don't know. Interesting. I mean, like the nerves obviously like transmit the pain or, like make you feel it. But yeah, I don't think there's like a problem with the nerves. It's very muscular for me. Your jaw locked on the day you had to get your braces off and they had to force it open. Oh my God. Poor Shelby. Oh my God. You poor thing. I feel horrible for that. Oh my God. I'm so sorry they had to do that. Why couldn't they just wait to another day? I don't know. Oh God, I can't even imagine that. No, it's totally, Jake, totally fine if it's off topic. I'm actually shocked that like so many questions and people are relating to this topic. I mean, I'm not shocked, but at the same time, sometimes if I have like a live stream topic, it's not always just about that topic. But you said that you have a lot of palpitations and heart racing after eating. Yeah, I know that like a lot of people like experience that. I can experience it. This is different, but like I do have a food that triggers it for me, and mine's chocolate, and literally that's the only food I can think of that triggers it. But so many people, like let's say if they like, I know some people with MCAS, mast cell activation syndrome, they will experience that as well. I definitely experience fatigue and like not unwell sometimes after eating, not related to my gastroparesis, and it's like something that I ate is affecting me in some weird way, So your chiropractor puts your jaw back in for you. He uses a small device that gently taps it back into alignment. Oh my God. That must be really, really painful. So does that mean that your jaw is just like constantly like over? Is it like what's the like how does that work? If you feel free to share if you want to. Okay, so you said when your ears get cold, it's like the worst, most debilitating migraine, and your doctor thinks it could be due to MCAS. Interesting how they think it could be due to MCAS. I wonder if it's sort of like triggered by the same thing that like when my ears get cold, it causes me such bad jaw and neck pain. Might be different, but I wonder. Hi, Bert. Hi, Elizabeth. Are ADHD and HEDS comorbid? I don't think so, no. Did my family ever think I was faking my symptoms? No, they didn't. But I think, first of all, I got lucky in the sense that when I was younger, some of my like problems were injuries as opposed to just chronic pain. So for certain things, they could see and they understood the source of it. So like, let me just make that a little bit more clear. So one of the worst and like the biggest thing that happened to me as a kid was that my left knee like fully dislocated, and prior to that had been subluxing, and I would be kind of off my feet for a day, 2 days, just icing. I would have to I couldn't really go anywhere after that, but then I actually dislocated it, and then it was really bad. And for years and years up until before I had my surgery a year ago, I've been having knee problems. But obviously when it dislocated, that was like they couldn't not believe it because, my MRI showed a dislocated knee and a torn something. And I don't know, like things like that. And then doctors were confirming it, and I was doing PT and wearing a cast and couldn't walk. So, and then something similar, such as, like twisting my ankle, it would swell and it would bruise, and then it would take a week and then it'd be back to normal, but maybe I'd still have some residual effects. So the chronic pain that I may have had in these joints were like obviously from incidences that were related to my EDS, but weren't known at the time. So at least when I was younger, my parents, like, there was no way that they couldn't believe me. You know what I'm saying? But then when it got worse, like to the point where it was just chronic pain in a bunch of different areas, they never didn't believe me. And I'm so lucky that they didn't not believe me. And there's something that I did that made them just believe me, because I know a lot of people like want to know how to make your family believe you. And I think it's so awful that they don't believe you. Like, I totally feel for you. That's really horrible and scary. But oh my God, brain fog. I don't know what I'm talking about. I have no idea what I'm talking about. Believing you. Got it. So, but no, like they didn't. I've had some doctors, like, not really, like, I've had like a few bad experiences, but like my family, I think later on, I know my dad was like, yeah, like, I'm sorry if I ever like made it, like, once I got diagnosed and he really started understanding everything, like, I know he felt bad and he like apologized, but he never didn't believe me. I just don't think he understood the extent, and when I was a kid, like, I'd ask them sometimes to like carry me. Like I didn't want to continue walking. And obviously they just took it as, okay, she's just being really lazy. Come on, stop complaining. I used to complain a lot because I was like in pain, or I hurt myself, or I didn't feel good, and it was just a lot of stop complaining. But I didn't, as a kid, sit them down and say, there's something wrong, so it, your doctor said that you were faking symptoms. It's so common. So many of us hear that. Literally, it's ridiculous. So many of us hear that. Horrible. Gloria, it sounds like your parents didn't believe you and thought you were faking it. You said that you fainted last week. Oh, you almost fainted because you donated plasma. Yeah, I think, I've actually heard, when people donate blood, for example, or maybe plasma. I don't know. I haven't really know very many people who donated specifically plasma, but like blood for sure can like make somebody faint. Like you're down a lot of blood, you know. I'm sorry that you experienced this. Are you feeling better now? Like I know that your body replenishes it, so I'm wondering, are you feeling back to yourself now? Did I ever need braces? I had braces on, literally on like between I think 4 or 6 teeth on the top for like 2 months as a kid, and I was in 3rd grade. I had it before like anybody else had it, which was such a blessing because then as I got older and everybody else was getting braces, I was like, I'm done with that. Like I felt really cool. So but I remember I felt really cool when I had them as well because I was like the first person, maybe first or second person in my grade. So I thought I was the shit. And I saw all these older kids getting braces. You know, they all had them. But then as I got older, I realized I don't want braces. I'm glad I'm done with that. And then I was cool again. So I guess the moral of the story is get braces really early because you'll feel cool when you have them and later. Just kidding. You don't have to do that. Marina, you're saying that like you from that experience from donating plasma, like you can more understand what it's like to feel potsy. Yeah, like that would totally make sense. I'm pretty sure. You know what? I'm not going to say this person's name because I don't want to like out them, even though everybody knows this person smokes so much weed. They're my friend. And like literally, I'm pretty sure whatever. But they feel like when they smoke weed a lot and like they get really high, they experience something similar to a lesser degree. They're not fainting, you know, like they're not falling on the ground, but you know, they feel their heart races when they stand up and their vision blocks and they feel breathless and not that great. So I guess maybe they don't stand a lot. I don't know when they're high. I don't really know, but I was chatting with them about it and I just thought that was very interesting. And I can understand that because as somebody who like, I guess I still do medical marijuana. And I used it for probably 2 months. Fucking hated it. Horrible. Don't do it. God, I hate that feeling of being high because I'm so anxious. I just turn into such an anxious wreck. I hate the feeling. I literally am crying, having a panic attack for like an hour. There were only 2 times where I got really high. And both of them, I was debating calling 911 because I was so anxious. And I'd say it was hard. How ridiculous is that? How fucking ridiculous is that? But it was horrible. I don't do that anymore. I fucking love CBD though. I am all for CBD. How do you guys feel about both CBD and medical marijuana? Or even if it's not medical, I don't give a shit. Marijuana. Let me know. Oopsie. As always, I'm really behind on comments. Let's get to them. Okay. Oh, interesting. So you're saying you have the arthrochalasia type of EDS. I'm actually doing like a lot of research. Like I was just doing it yesterday on the arthrochalasia type of EDS. I wonder if you have this one. I think it was like it was call 1A1 or is it, you can also have call 1A2. And I was talking about missense mutations. And I think it was like an arginine substituting for, a cysteine substituting for an arginine or something. I don't know, whatever. I shut up. Okay. Does duloxetine help with any of my POTS symptoms? If it does, I don't really know. It might. I will say that my cardiologist was very happy that I was on it not for my POTS, and she said that it can be good for POTS. And then we increased my dose. I take 20. We increased it to 30. Took it for like a month. No, I took it for like 2 months, 3 months, maybe. Actually, I have no idea how long I took it for, but a decent amount of time. And I was like, I don't notice really any more pain relief. And then I was feeling kind of weird. First of all, it makes me very tired in the mornings, right when I wake up. And then, but I get over it. And then I was just kind of feeling a little bit like bubbly. not in personality, in mental state. I don't know. Like the world was bubbly looking. Guys, wait. I'm gonna out myself for embarrassment, but I don't fucking care. I'm obsessed with cheer. Like obsessed, not actually. Okay, like a minute ago, I was like, I hate when people are really obsessed with things, but I mean, like, I meant like really, 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 really obsessed. You know what I'm saying? They're like, oh my God, I'm gonna marry that person. I'm like, okay, shut up. No, you're not. I'm such a bitch. I'm sorry. But I love Cheer, the TV show. So I just bought a sports bra that says Navarro, and it's like an official one from Rebel Cheer, or Rebel, whatever it's called. Guys, I want to be a Navarro cheerleader so fucking badly. God, I've always wanted to cheer. Always. That was really awkward. Okay, Costa, got it correct. Good. Do my voice issues, I think you're asking, appear like a froggy voice when waking? No. I'm not even really sure what that is. Oh, like you a frog in your throat? I don't think so. Okay, Britt, you said the answer was Costa with an O as cost. Yes! Okay, good. That's what I call it. Oh, Marina, you said you've been donating, I guess, plasma for 2 years so far. That's so freaking awesome. That's really, really great. So when I was a kid, I was terrified of getting my blood taken, and I had to go to a therapist who was only for children, who specialized in people who are scared of like medical things, who like, maybe, have cancer or something, or that they need to do a lot of treatment. I just had to get my blood taken. And I knew it was ridiculous, but my whole life I've always had like this like fear of forearms. Not a fear, like I can look at a forearm, but like I've gotten over a lot of it. But like especially by the wrist and by here, like it still disturbs me a bit. I get a little queasy. I don't know why, but I guess because they're like sensitive parts. But like the idea of putting a needle in there, like guys, oh my God. It terrified me, and I'm such a good patient in my opinion. Like I'm not gonna scream. I'm not like, but I am gonna cry. But I'm not gonna scream. I'm not gonna move my arm. I'm not gonna stop you. But like anyway. So I had to see a kid, like a child psychiatrist. It was a psychiatrist actually. It wasn't a therapist. I think it was a psychiatrist. No, they didn't prescribe me the Xanax. I had to get really high on Xanax to go do that. It was a different psychiatrist prescribed me Xanax to go get my blood taken. Guys, I was so scared. Why did I say that? Oh, anyway, so as a kid, obviously I didn't donate blood before I was 16. And then when I got my blood taken, whatever, and then I got kind of used to it. Now I'm okay. I mean, I don't like it, and I really don't like it at all, but I'm fine. But now it's like I feel I would love to donate blood, but I can't. And it's always because of POTS. But I really wish I could. So instead, I'm going to try to convince Ben, my boyfriend, because he's got a lot of blood. I can tell, his veins are just like real big. So I'm going to try to convince him to donate some blood. Okay. Okay, you said you kept telling your dentist that your jaw was locking and he didn't listen to you, and it ended up locking, and he was like, okay, okay, well, at least that shithole saw. Sorry, okay. Like, what does he think, you came in and lied? Like, I just don't fucking understand. Like, when doctors don't understand patients, like, to like an extreme degree, where they're just like, I don't believe you. Like, what do you think? I fucking paid for this appointment, came here to be like, let me tell a lie today for some fun. Like, I'm just trying to not get so pissed. Like, what the actual F? Okay. Okay. Okay, bye. Yeah. there is a there is an association to some degree between autism or autism spectrum disorders and EDS. But and not to say that a lot of people with ADD don't have ADD. Like a lot of people with EDS can have ADD, but with that one, there's like no confirmed link at all. With autism, I think that there's an association, but they're not considered comorbid. At least not now. Maybe they will be considered comorbid, and I wouldn't be shocked because I do know that there is an association, but I don't believe that it's like an official comorbid condition. I guess you wouldn't even call that a condition, but thinking in two medical terms. Yeah, your parents just called you a complainer. Yeah, I think a lot of us can totally agree that that was the same for us. You said you're a dancer and you have a lot of joint pain. You don't know if it's something like HSD or EDS or just because of dancing. So I'm sorry that you're dealing with joint pain. That sucks. You definitely should see a doctor about this because even like dancing, I know can be painful regardless, like just for anybody. There's so many things that can cause some pain, and some of them are really easy to treat, or relatively. Like I know some people who have very, very minor cases of like an autoimmune disease where they just take a pill and they're fine. Not everybody with autoimmune diseases are like that. I'm not saying that. It's not that simple. But for some people it is. So it could be something like that, or it could be something else. In terms of suspecting HSD or EDS, a lot of dancers are flexible or hypermobile. But just from what you're saying, like if you're dealing with pain, it's like EDS is going to be something that's considered way later. Like, there's so many things that cause pain. So I would just see a regular doctor, maybe a rheumatologist. Actually, I'd probably just see your general practitioner or PCP or pediatrician and just let them know what's happening and see if they can maybe refer you to somebody or if they can figure out what it is themselves. Because it's unlikely to be EDS or HSD just if you're dealing with joint pain, but it's probably, something maybe that is not too hard to fix or something that you're doing that's making it worse. Yeah, I think that's like a very important conversation to have if it's bothering you. I lost my spot as always. Okay. So you have panic attacks from being too high, but as long as you dose correctly, you're all right. CBD has been amazing though. Yeah, okay, CBD really, really helps me. I really don't like THC. I don't notice that it does anything. And like, I really do notice a difference with CBD. Like, I feel like because this there's a CBD company that I really like, Bloom Farms, right? And they've sponsored videos of mine in the past. And also, I asked them to sponsor a video coming up just because I freaking love it. But I'm not allowed to say, any claims, you know what I'm saying? That, because there's no, it hasn't been proven that, CBD oil does blah, 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 blah. So I can't, say it, even though, in my opinion, it has helped with a lot of things. So I just can say, I'm pretty sure because this is not sponsored or anything, I can just say it really does help. I think it makes me feel better, mentally. I don't know. I feel more energetic and I just feel a bit less achy. I'm not saying that for sure that CBD does this. I can't make any claims, but I'm just saying I've noticed that since taking it, and when I do and when I don't take it, I notice a difference. I fucking love CBD. Okay. Okay. Your head hurts, but you don't like the feeling too much, but it stops some of the pain. You had your head on the right side, and your shoulder blade, and you, okay. You must be off. Live long and prosper. Oh, bye. You're prescribed a medical card for your TMJD. Oh, that's funny. That's for TMJD, and we're talking about that. It gets rid of your anxiety and helps your pain. You love CBD too. It helps with your arthritis. With your cat's arthritis. I was like, what part of the body is the cat? Oh, didn't say that, undo. But that's so funny that it gets rid of your anxiety, because for me, it's like the opposite. I've heard both. I've heard that people are like one or the other, you know, it like either makes you have panic attacks or it calms you down. I wish I was on that second team, but I'm not. CBD is great. It makes you feel, especially if you're getting anxious due to pain. Oh, let me turn this off. Hi to the UK. What do I take for pain? The main thing I take is duloxetine every single night, and that has helped me significantly with my pain so freaking much. I can like exercise now. Like I have a bike now, like a stationary bike at home. Like I couldn't really do that before. It would just hurt so many things, you know, like sometimes I would try and I would do it, but it'd be so painful, and then I'd be recovering for like a day or two, or like something would then bother me. Like now I can, like, I fucking love it. Okay, whatever. And then ice, I ice probably at least 2 times a day, a bunch of different things. I use ice all the fucking time. And a big part of that also is because it's like summer right now, and in the winter time, I don't really like to use ice, even though I should. But I don't like to use it because it's cold, and I'm cold, and I get cold really easily. I'm realizing I think I've missed some comments, because I realize people are like responding to each other about things that I don't think I saw. So I'm sorry if I have not answered your question. If something's not a question, sometimes I'll just read it and like not respond. If it's not something that like, if it's not for me, you know what I'm saying? Like it's a response to somebody. Oh, interesting. Plasma donations can be twice a week. Full blood is only every 8 weeks. Cool. And you get paid for donating plasma. 4 millimeter Chiari. Okay, so it sounds like somebody on here has 4 millimeter, like, is that how much it's moved down, Chiari? I don't know that much about Chiari. I know what it is, but you tried donating blood, but your hemoglobin was too low and they sent you away. Oh, I'm sorry. I'm sorry that your hemoglobin's low. What would I do when you've been passed about between many doctors and back at square one, being referred to rheumatology? This is my life. Okay, and stuck on codeine max dose for months with no answers or extra relief. Okay, so other than the last part, because I didn't take like codeine or anything, but I was not at such a pain level, but I was dealing with a lot of chronic pain and so many stomach and other issues, and I was literally being passed off between doctors. And I love that you said, and like, it's just exactly the same. People keep referring me to rheumatology. So this is way before my ADS diagnosis, and this went on for years. What I ended up doing, and this is not your job, I'm just going to let you know some of the things that I did. I educated myself to then bring up ideas to doctors. And this isn't something you should have to do. Most people probably don't do this. You also have to know that you're the kind of person that's like able to do that, in the sense that like, one, you're interested, but two, that like you don't freak out at these things. Because I think many people, you know, would get anxious learning that something could potentially be the cause of their symptoms. And I don't really get anxious about that. So I know I was okay to do that. So I did a lot of research, and then I would bring certain things up to my pediatrician, and we'd chat about it. And then maybe sometimes she'd refer me to somebody. So, and we ran a bunch of tests, like all the freaking time. I would get blood work like every few months, every 2 months, maybe we'd be doing blood work, and a lot of blood work, trying to test for different things and seeing if we could connect the dots. I totally know what you mean. You're just being passed off from doctor to doctor. And the truth is that there's going to be in all likelihood, there's going to be somebody who can figure out what's wrong. And even if not, there definitely is somebody who's able to help you. And a lot of people, but a lot of doctors, but it's it can be hard to find, especially when you have something that's not so obvious, and that sucks, and it's so hard. It's really difficult. If you can, this is my suggestion, is just keep going to different doctors, and maybe if you're interested in doing so, research doctors who have like so for example, let's say you live in Baltimore and you always go to Johns Hopkins. Try going to a hospital in like Philly or something. Is that far away? Is that I'm thinking that's like really close. That's not that close though, right? I don't know. If that's like 30 minutes away, that it's gonna be like an hour away, never mind. But I'm saying like try to go to a different hospital or a different, you know what I mean? Because then you're gonna maybe get a doctor with a different thoughts, and maybe forget about that idea. Look up the doctors and go to doctors with different specialties within their overall specialty, or go to doctors that did different schooling. So you got somebody at Johns Hopkins, and then you got somebody over who went to school in Colorado but works at Johns Hopkins. Go to that person if you feel like you've been going to a lot of people who trained at Johns Hopkins. And the reason I'm saying that is because maybe they got different training and they'll think of different things. And the truth is that sometimes it's like a game, except it's your health, which is horrible. But there's no other way to do it other than like play the game of, can this person figure it out? Can this person figure it out? Because eventually someone's going to be able to find something that's going to help you, even if they don't know the answer yet. Again, it sounds like you don't like being stuck on codeine max dose for months with no answers or extra relief. That sounds horrible. At least if you could find somebody right now who's able to give you that extra relief while still trying to figure out where to go and who to see, you're going to find somebody. It can take time. Just because it might not be likely doesn't mean it's not EDS. I think you know that. Yeah, right. No, of course. But if somebody is going in with pain, if one, like if somebody just has chronic pain and no other symptoms, EDS should not be somebody's first thought. It could be a thought. It could be something that you think about, totally. But trying to find somebody who is to think about EDS as a possible cause of pain before searching at anything else, it's unlikely. And yeah, we're all the unlikely, at least now, because it's not considered common. Like we've all been that unlikely situation when doctors haven't thought about, could it be EDS? And then you're like, well, it could be, but then they oftentimes think that no, it definitely can't be because that's too rare or something, or you need this, you need that, and a lot of it's misconceptions. What I'm just saying, if it was not clear, is that there's so many things that cause pain, and EDS is one of hundreds and thousands, like honestly. So. Okay. You had surgery for your TMJ dysfunction 2 years ago, but it's getting worse. Oh gosh. What kind of surgery was it for your TMJ dysfunction? If you would like to share, I'm interested. That's really sad. I'm sorry that sounds difficult that it's getting worse. Did it get better at all? I'm curious if you want to share. Let us know. You've tried CBD oil, and you didn't really feel any different. Maybe you have to try a different brand. Yeah, maybe. I've heard, a bunch of different things. People respond totally differently to different things. The strain of weed apparently affects paranoia, anxiety, because you get a different type of high, so maybe I'll look into different strains more. Yeah, I've heard that too. I think I've tried different strains, but New York is kind of hard with that. It's hard to figure out information. So exactly what strain you're getting. But yeah, I mean, I guess I could try that again. But also, it makes my pulse really bad when I'm high. So you're saying, does anybody have issues in eating? You have someone apply pressure to your temples and TMJ joints when you eat and no one can figure out why. Oh, I mean, yeah, with my dysfunction of my TMJ, oh my God, totally. It can be very painful and difficult to chew, 100%. You're saying duloxetine didn't help with your mental stuff or your pain. Yeah, I think some people it does literally nothing, and other people it can be really helpful. Your orthopedist recommended New Balance running shoes, and oh my God, they're heaven. That's so funny. But you don't recommend them if you have hip. Oh, you do recommend them if you have hip, knee, back pain. Okay, cool. I've heard about New Balances, but never had them. Are you not allowed to donate blood if you have POTS? It's not that you're not allowed. It's just that my doctor told me not to. I have already told that I have hypovolemia, just like a low blood volume. So taking out my blood would be really bad. Even if I didn't have hypovolemia and I had POTS, it'd still not be great because the movement of blood throughout your body is not good because of your POTS, or maybe your POTS is caused because of that. But so it's like if you have blood pooling, your body is already when you're standing up using less blood circulating to your organs and things that need it because it's kind of like stuck in your legs. So reducing the amount of blood you have can be bad. It's not that you're not allowed to, but for me, my doctor said definitely not. You said your rheumatologist is like a primary referral doctor in pain management, so he at least educated in EDS. So when things become an issue, he just refers you to that specialty and orders blood work. Oh, that's so cool. Yeah, I love when like a doctor is like very knowledgeable and knows people and knows like who to send you to and things like that. It could be really, really great. How do you keep anxiety? How do you keep the anxiety of coming off as attention seeking or faking when bringing up as a potential diagnosis to a doctor? Like, do you straight up think I have X or more symptoms? So the thing is that first, two things I'm gonna say. One, I have really bad anxiety, but it's not about it is about my health, but not all of it. Some of it is. But it's not about like, could I potentially have this or could I potentially have that? So I want to like just say that because I think that it's gonna feel a little bit different if I don't say that, because for me it's not really a source of anxiety. But when I'm thinking about like if I'm reading about stuff I'm talking about, like I don't really get anxious, but I know exactly what you're saying when bringing it up to the doctor, regardless of how I feel about it. So for me, I don't ever think I have something like for sure. Like that's not how it should be. It's not like you know what I'm saying? Like it's totally fine to do your own research and learn about stuff. And then if you see something where like, wow, like that fits my symptoms, don't bring it up like you think you have this, because you can't like know if you have something, you know what I mean? Like without, I mean, you can, but that's not, it's not good. And you don't want to like make the doctor feel like threatened or something. I don't freaking know. Or like I don't really know, but I think the way that I would approach it and have in the past is, so like I sometimes do my own like looking online. I know that can be controversial or whatever, but I did come across something that I think can describe some of my symptoms. This is it, like EDS. So it's like, I think it's, you know, like I'm looking and Mom, I keep hearing a noise and I don't know what it is. And I keep thinking my mom's trying to come in my room, but she's not. Maybe she's just going to my sister's room. I don't know. But it's like, I keep thinking she's coming in. What I'm saying is I would just say, you know, I think that this describes my symptoms. And do you think that this is a possibility? Like, I wouldn't go and say, I think I have this, you know, like you should probably say more, this describes my symptoms and I want your opinion. So somebody else likes Skechers, and they're even lighter, and they're just as comfortable as New Balance. So I used to love Skechers all the time. And then I outgrew them, I feel like, but I loved them. Oops, lost my spot. Okay. Oh, Liddy, that's a really sweet message. I'm so happy to hear that my videos could give you some motivation to fight for a diagnosis. said, you know, I've done videos, but how's the knee? It's okay. It's still healing. I'm in the process of making a video trying to talk about like specifics. I have to see my doctor. I'm actually extremely behind. I'm seeing the, what's it called? The PA. Is she a PA? Yeah, I think she's a PA. She's there. Yeah, she's a PA. I'm seeing her like online in an online appointment like next week, I think. But I was actually supposed to see my surgeon like 3 months ago, and then everything kind of happened, or maybe 4 months ago, and it was like in March, and I couldn't. And then I've just been chilling, not seeing her, and I'm not healed, and it's been 12 months. So, but it's very stable, which is great. Why do a lot of neurologists just want to push injections instead of giving you a series of tests and stand-up MRI? They said it too blurry. Like they said it too blurry. Not sure if that's true. Okay, I'm not exactly sure what you're trying to say, but from like what I think there's just a typo. But from what I can understand, what you're saying is that your neurologist isn't running tests, but rather is just trying to give you injections, I guess, to help the symptoms. And I mean, I think that this is a good question to ask the neurologist, because maybe there is a reasoning. I know you're saying that something's too blurry, but like, I guess you're saying the stand-up MRI is too blurry. I don't know. If you feel like you're not, like your neurologist isn't really like explaining things to you and is just sort of giving you treatments that aren't working without doing tests, I would probably see a new neurologist, because that does kind of sound a little sketchy. You know what I'm saying? Like, I don't know. That sounds a little bit weird to me. I'm sure like everything they're doing is like not like illegal, but like I would probably try to find another neurologist who will explain things to you and who will want to test you for something before like giving you a treatment for it. Yeah, that's probably what I would do if you feel like when talking to your neurologist and asking them, they're not giving you a good answer either. Like they're like, well, doing the test would just be too blurry. Like, that's weird. Anybody get achy eyes and light sensitivity with TMJ? I get like achy eyes. Like, I like that you said that, because it's like such a good way to explain it. But I don't really have light sensitivity. But I think I've heard that like being a thing with TMJ. You're having a lot of jaw problems, like locking, cracking, and popping. You do have EDS, and it sounds like, does it sound like TMJ? I mean, probably. I think just because that's so common. But like, it could just be general EDS stuff too. If it's really bothersome, and this is something I really should be doing, I would see either a jaw specialist or just somebody who you feel like would be okay with dealing with the jaw to tell you if it's TMJ or if it's something else, or if it's kind of just general EDS, because maybe they can do something about it that they wouldn't be able to do if it was TMJ or if it's not TMJ. You know what I'm saying? Because I'm sure it could definitely be like either one. It could just be general EDS, or it could, like, you know what I'm saying? Like if you already have EDS, like, or TMJ or something else. I don't know. I feel like this YouTube, like the YouTube comment section, like kind of sucks, because every time I try to scroll down, like it just goes, like it makes me lose my spot, which is really annoying. And then like this happens literally every single time. That's why you hear me say I lose my spot. Like it moves, like, and I have to figure out where I was, which is always really behind. Okay, wait, hold on. Two things. One, okay, I got this. It's really big. It's really big. So a lot of people like these stickers, and a lot of them wanted it in a bigger size. So I got it in a bigger size, and it's freaking huge. And I don't know, it's really big. I mean, I think it's fantastic. Anyway, I put it on my Etsy. So if you want it, go to my Etsy. Actually, I'll just link my Etsy. But my other question is, if it fits in this envelope, and I'm trying to figure out. Obviously, I'm gonna like cover it and make sure it doesn't like get folded or anything. But like, can I just mail this like with a stamp? Like, do I need 2 stamps? Do I need something specific? I've been watching videos and reading about this, and I literally cannot get a straight answer. And I don't know why I can't get a straight answer, but apparently mail stuff is really difficult. But so I'm trying to figure out if I can just mail this or if I have to go to the post office. Anyway, let me know if you know the answer, and go get one of the big ones if you want one of the big ones, because I've had multiple people say this is cute but really small. So definitely got it a little bit bigger than I thought it was going to be, but I chose the size. So why didn't I choose something bigger? Smaller, I don't know. Oh, I linked it here, by the way. In the thing, I put the Etsy link. Your geneticist told you definitely have HEDS, but you're not going to give you the diagnosis since they haven't isolated the gene. I never thought this process would be so tiring. Yeah, that's really weird. So it sounds like, well, so they said you have EDS. Okay, that's really weird. Everything is so confusing. I have to be honest. It's I'm really holding out that within the next handful of years, more gene markers are found, because it really is a huge shit show. Let's be honest. This whole HEDS, HSD, hypermobility, it really is a shit show. Like, and there's definitely different causes for things. And even if it's, all inherited, there are different genes, and we haven't found a lot of them. And it's really, really hard to get properly diagnosed and then receive proper treatment. Really, really, really hard. God, it sucks. No, I lost my thought. Okay, found it again. Your primary's been checking my inflammation levels for a while, and then I mentioned EDS, and he was like, "Oh my God, I think you might be onto something." That kind of like definitely reminds me of what happened with me, is that everybody thought it was an autoimmune disease, so they were constantly checking for my like ANA and C-reactive protein and sedimentation rate and everything really fun like that. And obviously it was all negative because I don't have an autoimmune disease. And they just kept checking, thinking that every few months we check, thinking that something would finally appear, but nothing did. And then I ended up bringing it up, and everyone was like, maybe, I don't know enough about it. Maybe, can we find you a doc that does? And this was literally the same conversation every single time. And then I found a doc who knew. And then one doctor was like, no, you definitely don't have EDS. It only affects eyes and heart. I don't know why you would think you have EDS. I was like, okay, bitch. She like made me feel like weird about it. And I was like, okay, just like, clearly you're the one who doesn't know anything, but even still, like, why don't you talk a little bit nicer? Whatever. Any tips on weaning off of meds? You've been on POTS meds for 3 years and you're starting to come off of them. Interesting. I feel like I wish I could give you some good advice, but I actually sort of feel like I don't necessarily have some advice. I mean, I guess the best advice I can think about is that it like, even if you're not feeling so great while weaning off, and it's a struggle, if you want to be at a point where you're not on the meds, just know that at a certain point it's going to be, you'll feel okay. Like, you know what I'm saying, without the meds, but weaning off things can be difficult. And that is the hardest thing. Dang it. Anybody else can you guys give some good advice? Because I've not weaned off very many medications, so I don't know if I really have the best advice, but I really want you to have some advice. So maybe others, they can share their experiences or something. Okay, I'm still going. Sorry, I lost my spot. Talking about night guards. So you're getting your braces off on July 16th and you're scared about it. I mean, when I got my braces off, I was really young. It wasn't bad, but I didn't have TMJD then. So I can imagine that it's going to be really sucky. Let them know that you have jaw problems. I'm pretty sure you said before this you had TMJD. And tell them that, like, what's difficult. Just let them know before you do it. And maybe they have something to help you, or they can give you breaks, like give you a minute to close your mouth or something like that. Just try to let them know, and hopefully they can do something. Your night guard helps you so much. You don't grind your teeth, but you feel like you still clench. Yeah, okay, I think I do the same thing. Like I don't grind at all, but I think sometimes I clench because I've woken up clenching before. Oh, hello, Emma in Norway. So cool. Oh, and then hello from the Netherlands. I've been to the Netherlands before. Fun fact. Oh, I'm glad that you love the sticker. Thanks, Elizabeth. Okay, you need a non-machinable stamp. Okay. Can you just put 2 stamps on it? Or it needs to be a non-machinable stamp. Okay, cool. Do you know if you can send it internationally with a global stamp or how that works? I'm sorry that I'm asking for advice on this. I literally cannot find the fucking answer. Sorry that I cursed. I really can't find the answer. And I was like, should I just make it so I can only send it to the US? Because I think I can figure this answer out. But like, I feel kind of bad about that. So I'd like to not just send it within the US. So I don't know. You need the giant sticker for your car right next to your handicap plate. That's funny. I mean, honestly, then maybe somebody will become educated then, which is also, by the way, that's like one of the reasons that I got the sticker that size, because a bunch of people, I literally had multiple messages asking if I had it in bigger size, and multiple people said because they want to put it on their car. So then I was like trying to figure out what size to get it. And I was like, okay, so this was, I think it's 5'6" by 7. And I'm thinking to myself, okay, like that'll be like this big. That's not, I was surprised when it arrived today. I was like, that's a lot bigger than I thought. But I think it's adorable. It'll be perfect for a car. I don't have a car to put it on. I mean, my parents have a car, but it'd be a little weird if I just stick it on their car and don't tell them anything, you know? There's scales at the post office you can use to find out how much it weighs. You might want to nail with a piece of cardboard to make sure it doesn't get bent. Oh yeah, totally. I'm gonna like put it on something. Yeah, I wouldn't just stick in the envelope. It would totally get bent. Did you watch the seminar the past couple of days? You're still kind of confused about HSD and HEDS are the same, but not the same. Okay, Elizabeth, I have a video for you. I'm watching the EDS conference. And I watched the part where they explain the difference, and they literally, okay, it's exactly the same as I did in this video. This video will explain to you exactly the difference, and it's exactly what they explained today. It's confusing. It is, but I just posted a video that I made like over a year ago discussing the differences. And things are going to change over time. And I think I'm going to make another video discussing the differences soon because it is really complicated. Lost my spot as always. Okay. You're currently stuck between HSD and HEDS with your diagnosis with different specialists having different opinions. So confusing. It definitely can be confusing. From this EDS Society's opinion, I don't think that it really, really matters yet which one it is. But the good thing is that like it's okay. Like if your doctors are debating between the two, the treatment's supposed to be the same, and you can just let future doctors know that currently your doctors are discussing it's either HSD or HEDS, and they're gonna totally at no point is your treatment going to differ if you say that. If you had HSD or HEDS, and let them know that you don't have a diagnosis of either one, and it's one or the other, and we don't know yet. Just let them know, like, and you'll be treated the same way. I mean, it'd be either way, the same way. If it's HSD or HEDS, a lot of people with HSD do have HEDS, but the diagnostic criteria is not going to show that. Also, guys, I asked a question today and he answered. Okay, I was at the conference on my computer watching the conference, and I said they answered 3 questions. I was one of the 3. Felt so freaking special. And this who was it? Was it Hakeem? Okay, somebody answered it. I can't remember. And they said that I asked, why does the Baton score test the joints that it tests? Because I think it's ridiculous. And they explained that they're thinking about changing it, kind of, and that they're looking into potentially doing more joints, because testing those 9 places will likely indicate if you have generalized joint hypermobility. But they said if you don't pass it, like in their clinic, like, or the way that they do it is they keep testing other joints too, which is not what the criteria shows, and it's weird. Whatever. I'm sorry that you're struggling with pain and symptoms due to gastroparesis and a hernia. I'm sorry to hear that. Your cousin is an MD, and she heard that you have EDS, and she was kind of excited because she thinks some of her patients have it, and she asked me how I got diagnosed, since I'm the first in the family. He said TBC. I guess that means to be continued. Okay, of 54. Oh my God. First in the family of 54 cousins. Oh my God. And no one has been diagnosed. If your family is accident prone, so you went through years of testing and got a positive. So she refers to you. But yeah, the excitement of an MD, I totally understand. Like, not excited that you have it, but that you know what it is. Now it's also kind of interesting from a different perspective. Let's see. Your face muscles get so tight from grinding and clenching. You have to massage them all the time. I totally feel you. Exactly the same. Hi to Germany. That's so cool. Have I been to Germany? I've not. No. So go use a scale at the UPS or USPS. It'll have you put it in the address and tell you how much the postage is. Okay, I'll do that. I might just okay, I'll do that. You sent from MS to Mississippi to, is that Mississippi? To Virginia with 2 stamps, and it was like 3 pages of stickers and a letter. Okay. Was it big though? Like, I feel like like a normal sized envelope is, I don't have another envelope. A normal sized envelope though is like, I don't know if you can tell how big this is, like would be like to here. So I'm just like scared that this is way too large. You should get one of the stickers to put on your wheelchair. Yeah, a bunch of people have done that. I saw somebody do it. Where was it? I think it was on their cup holder, and it looked really cute. But they did one of the small ones. I think that this would be a little bit large to try to wrap around something. You haven't put anything on your wheelchair, and you just got it modified with a strong back, not a sling. Ooh, that sounds more comfortable. And your new chair is coming, is full carbon fiber, so no color on it at all. Oh, you recommended TENS unit. I like TENS units. Mine's at my mom's house right now, so I don't have it with me, but I've used it on my neck and my shoulders. I really like it. It's not like it helps so much, but I do notice a difference. You missed the psych meds part. Are we talking about how they can cause grinding? I don't know. Some people are having like, a lot of times people have conversations like in the side along it. So I don't know what the psych meds part was. We were talking about duloxetine, and then we were just separately talking about grinding our jaws, but I don't know if people were connecting it. So you can look through the comments because I hadn't said anything on that. Will I be doing a gastroparesis vid for the month of August? I definitely will, for sure, 100%. Okay, you said the same size, the envelope. Hi, Izzy, do you think a face roller like a jade roller would help with TMJ joint pain tightness? You're thinking of ordering one to see if it helps. Wondering if you've tried it before. I have tried it before. I do think it's pretty good. I like it. I have them at my mom's house. Try to get a good quality one. Like, don't get one from Amazon. Like, I guess you can, but because sometimes they like fall off the like metal thing. But I really like it a lot. I think it definitely helps with massaging, and it's easier than having to use your fingers if that's hard for you. Yeah, envelopes go off weight, but they also go off size, like, or sort of. They go off, like, there's, like, non-machinable sizes, as somebody said. It can't get processed through, like, the machine, so then you have to, like, pay more. It's weird. By the way, I'm going to go soon, just letting you know. So ask any last questions. When you have jaw pain, do they see it in an MRI or scans? So in my experience, nobody's ever done a scan or anything like that. I don't think I've ever had an x-ray. But just by feeling it around, listening to my symptoms, again, like having TMJD is pretty common, and there are some things such as massage that you can do about it. So I think it's pretty easy to diagnose without having to do anything, like scans, but they might be able to tell with scans. I actually don't know. If you guys know the answer to that, though, let them know. Hi from the Netherlands. We have multiple people from the Netherlands. That's so cool. I've heard that POTS and EDS are more common than originally thought. Is that true? I think it depends on like when you're thinking about, like, because POTS, I don't really know the history, but POTS is not uncommon. POTS is like, for like females, I think it's like 1 in every 100 have POTS. Like, I know so many people with POTS who don't have EDS. When it comes to EDS, again, it depends on when you're talking about, because even like 10 years ago, it was considered so much less common than it is now. And it's like every few years, the stats are changing. So is it more common than we currently have it set at, which is probably like 1 in 5,000? It probably is. And I think that like, that's totally, but there isn't a number. Like, there is no number that we have right now to describe how common it is. But it's from what I've been reading and what people are saying, like by people, I mean doctors that are specialists in this, it's more common than 1 in 5,000, but they don't know the number. Have I had my gallbladder removed, or have I had gallbladder issues? I've had doctors think I have gallbladder issues, but I've never had any tests done. So clearly it's not, clearly they don't think it's that big of a problem for me. I don't really know. Somebody wanted to do something, but I didn't want to do it. So he was like, some radioactive thing. And then I was like, oh, okay. Well, sorry. He was like, it's like a nuclear medicine, blah, blah, blah. And I was like, oh, is there like radiation involved? And he goes, no. And I was like, then why is it called the nuclear, blah, blah? He's like, well, we'll have somebody call you about it. And then somebody called me and they told me exactly what it's called. And I said, right. So you want me, so it's like, is it radioactive? I just want to have the information and just confirm with my, pediatrician. And they were so weird about it. And I looked up this test. It's obviously radioactive, which would be fine if they freaking like just told me. I just like want to know, like things like gastric emptying scans, like you're swallowing, like, what is it, radium? Like, or it's probably not radium. I don't know what it is. It's not, it's you got to do what you got to do, but I don't want to do that if I don't have to do that. And I want to know exactly what the test is, and I want to know why I'm doing it, what they might find from it and what they might not find from it, and then weigh it, because I don't want to get tests. I don't want to introduce more radioactive things into my body. And I don't want to, what I'm saying? Like when I had to get a CAT scan, I like asked 2 of my doctors, like their opinions, which probably sounds a little much, but I just, I have a family history of like a bad reaction, really bad reactions to radiation. So I'm very careful. like really bad reactions to radiation. Medical levels of radiation, not like a nuclear bomb exploded. Like I'm talking about like that, like radiation induced things. Sorry, I'm like a little bit behind. Okay. With POTS, do mosquitoes tend to bite you more? No, definitely not. That's such a funny question. I'm assuming that you're saying that because you get bit by mosquitoes a lot. I actually do too. There are different components to it, I've heard, that are genetic, and like the way that you smell or taste or what you wear that might be attracting them. Not wear like scent wise, things like that. But no, like having POTS, I mean, from my understanding, that would have nothing to do with it. But that's a very funny question. So somebody said they can see the wear and tear of the teeth and jawbones through an X-ray. Right. Somebody else is a mosquito magnet who has POTS. Can POTS be negative one day and positive another? Honestly, I don't know. I've never heard that happening. Maybe like if you have a cardiologist or somebody, I would ask them that, because that would like make me think maybe there's something that's making it worse on some days and not as bad on other days. Maybe like something that you're eating or doing. Yeah, that's very interesting. I would definitely talk about that with a doctor. Maybe you can find some patterns or something that's, you know, not making you bad. Oh, wait, you're saying, yeah, it's intermittent, like your sister's too. Have you ever had my gut microbiome tested? I think so. Oh, yeah, you got to do like a stool sample. Fun activity. Recommend. Yes, I have. It was great. Have you ever had workplace accommodations? I haven't. I've had school accommodations, but workplace, no. I'm trying to think, like I've done internships, but I graduated a year ago, and I haven't had any jobs. I mean, I've had internships, but no, I didn't. But they were all just seated, and I could get up and go to the bathroom. I could get up and eat a snack. Like it's been very chill, so I haven't had to. So unfortunately, I don't. Does anybody know anybody who is really good about that? Does anybody, like somebody with a disability, who's made any good videos on that? I'm sure there's somebody who has. I wish I could give more advice because I don't really have any, but there's definitely somebody out there who's made some videos on that could potentially give you some good advice. Can I post a link to the smaller stickers as well? Also, as a thought, have you made like a 40-ounce jug with an EDS design on it? No, I have not. But yeah, I can post the stickers. You should, one second. You could put it on a water bottle though. Like if I were to, like, I think this would look pretty good. I mean, this is a ginormous water bottle. This is like actually not a water bottle. Okay, so here's the link to the smaller stickers. Here, I'll just, okay, small stickers. There's a small sticker link. Here's the big sticker link. And then I also have my POTS sticker link. Here, wait, what's this one? Oops, hold on. Don't look at that link. Well, you can look at that link, but that's I'm a stupid. Okay, that was really dumb. I did not give you the link to my shop. I gave you the link the back way, which you can't look at. So sorry, redo, big sticker. Oh no, undo. Sorry guys, you hate me. Small sticker, here's the link. Dang it, I just gave you the big sticker link, guys. Okay, hold on. Okay. That is the small sticker link, I think. This is the big sticker link. This is the biggest fail of my life. And then also, if you have not seen it, I also have the pot stickers, which is this design, which is like a shirt. But I have it in the stickers. And then I also have this on the Teespring, on like my Teespring if you wanted it in shirts. Okay. Oh, okay. What's the EDS convention? I think it's too late to sign up. It's this weekend. Every single year they do like a meeting, and it's usually in person, but this year it's not. It's called the EDS. I have to be honest, I don't want to say what it's called because I never know how to pronounce this word. Consortium. I'm an idiot. I don't know how to say it. But yeah, let me link that to you. It's happening this weekend. I think it might be too late to buy stuff like tickets, but it's also happening tomorrow. So, all right, here's the link to it. So you can check that out. Okay, EDS convention or whatever. Here's a link for that. That's a lot of links in this. Are these going through? Oh, okay, cool. There they are. Because it wasn't showing for me. Your doctor said that your jaw muscles are 2 times as big because I clench so much. Oh, wow. I guess that makes sense because if you're clenching, you're like actually building up the muscle that closes your jaw and not the one that opens. I know for me, I definitely like the one that like opens it is weak for me and then the other one's strong. So somebody said workplace accommodations can be very easy or very complicated depending on your job. I've heard good stories. I've heard bad stories. Yeah, it really sounds like it's dependent on who you work for, which sucks. Shelby said she'll be making a video on her YouTube about workplace accommodations. So keep that in mind if you're looking for that. And cool, it's awesome that you have a channel. You would love to make a video, but you don't know how to make good quality videos. I was thinking about like doing a video. I feel weird about it though, because people don't really, so a lot of people don't care. I was like, oh, I can make some videos about like how I make videos and like what I do. But then again, like I feel like people don't care. And there's so much I have to say that it's like, like I want to make like a bunch of videos on it, you know, but then like people who don't make a video are just gonna be like, why are there all these videos on your channel about this? I don't give a shit. How do I cope with fatigue and POTS while in college? It's very difficult. I take my sleep and my health as such a priority, and then schoolwork, and then everything else comes way after that. But like, I try my hardest to get a lot of sleep. I try my hardest not to get too stressed because that always just makes it worse. And then what I do is, I mean, I take Vyvanse, which like really helps me with fatigue. And then when I start getting more fatigued towards the end of the day, sometimes I'll drink coffee. A lot of it is letting my friends just know what's going on. So at least I have people who can support me. I also let my teachers know the ways in which I'm affected that may possibly, unlikely, but may affect my semester. So that if I ever have to let them know something in the future, I'm not like making it up to get an extension or something. Like this is a issue I've had before. Hold on. You know what? My computer's sent. So I'm thinking doing this so it doesn't die. Consortium. Consortium. Okay, cool. Okay, thank you for teaching me how to say that word because that's so weird. It just doesn't sound right. But okay. Somebody's talking about jobs. Okay, I think I'm gonna go. I actually have to pee so freaking badly because I typically pee like every hour. I'm a big peer. Why am I saying this? Go check out my huge stickers if you want them. I put the links in there. Is there anything else I want to say? I feel like that's probably it. I'll do some more live chats. Thank you guys, live streams. Thank you so much for tuning in on this. And my next few videos, I'm gonna be touching, do it. I feel like my computer's lagging because my thing sucks. My thing's dying. How did I get prescribed Vyvanse? I've been prescribed Vyvanse since I was like 10. I have dyslexia and a couple other learning issues, so I've had that for that. Anyway, I'm gonna go. My computer's lagging and it's about to die. Yes. And I can't end it. Jesus. Check out my stickers. Guys, literally, my computer sucks. I've been having major computer issues for like an entire month. I'm trying to edit. Maybe if I click X.